Okay, folks, let me ask you a question. If we haven't figured out, if all the cardiologists, all the smart doctors have figured out the best testing to get done to prevent heart disease, why are so many people still dying of heart attacks in America? The number one cause of death is still heart disease. This is why this test is so important. This is why I believe that the CT coronary angiogram, which we call flow map, is something that should be used as a screening tool for at least high risk people such as yourself, right? The issue is that we have the technology now. Look at the way this scan works. You can see exactly every detail of how much blood flow is going through every blood vessel in your heart. It gives you all these different dimensions and 3D like perspectives that no stress test is going to be able to give. The only other test that's this good is going to be like an actual angiogram. And the problem is that this test is not covered by insurance, and this is why your doctors are not offering this to their patients. The issue is, yeah, these tests are all available. Your insurance will pay for it once you have chest pain or you have some kind of symptoms. Until then, we as doctors can't order this because your insurance companies will not pay for it. The good news is that these tests are now available for out of pocket payment, right? We understand not everybody's going to be able to afford something like this, but for those who can, this could be a life saving type of a test that you can get that shows you without any question how much blockage you have, right? If you have blockage, we found patients, about 10% of the patients, the high risk patients that we're offering this to, we find critical disease. They end up getting a heart stent or a bypass surgery, especially if you're of South Asian descent. Those patients are super high risk. And this is a life saving kind of a test that you can get for a relatively inexpensive peace of mind, right? Even if it's negative, it gives you peace of mind saying, okay, look, I don't really have any blockages and maybe I need to continue living a healthy lifestyle. But, it's either your first shot that you get a chest pain, you may be dead. You could get a heart attack and you can die, or you're on vacation somewhere, you have chest pain, you can't even get to a hospital where there's somebody there that can do a bypass or a stent placement. But if you look at the kind of imaging that it doesn't take a doctor to figure out what kind of imaging and value you're going to get from a test that is this sophisticated, right? What we're doing is we're offering this to patients as an outpatient. It's just like CAT scans, a 20, 30-minute CAT scan. You go in there within a couple hours, you're done. The scan is done in 15 minutes. You do have to have a little IV, but it's a pretty simple process to find out this kind of information that in years past, you could only get this through an actual angiogram. This is now available. The machines are available and we run a program. Now, here's the thing, folks, you have to have a doctor who orders it because you can imagine that if we find something, you're going to need a physician to go over these results with you so that you're pointing in the right direction afterwards, right? This is why this test, even though it's been around for a while, it's just not available to patients. We're making it available. It's very easy. You can actually schedule this online, just go through the link, and somebody from our team will call you to get the additional information and get you on a day that makes sense for you. But this is not something that you want to wait on, especially if you are already through this process and you've already filled out the assessment. We know you have high risk factors. And the fact that you're going through this and you're looking at this is telling us that there's some level of concern. Either you have a family member, bad family history, something in your family's happened to where you are now actually on the internet, you're perusing, something piqued your interest about this kind of a test. And this allows us to tell you exactly what kind of information you can get from something like this. I'll be more than happy to go over your results once you get them and tell you exactly what needs to happen next.